Okay, so in the last video, I guess this is where we got to potency. So we move on. Um, so when we talk about potency, potency basically refers to the amount of drag that we need in order to produce a certain given effect. Okay, so it's either the concentration of the drug or the amount of the drug that we need in order to produce a certain amount of response. Okay, and potency usually depends on the affinity of the receptor for the drug. So two drugs may do the same work, but then the extent to which they do the work would depend on how well the drug is able to bind to the receptor. So if the bond that is formed between the receptor and the drug is very strong, then it means that it will have a very high potency. You get it? Because when it binds, it's able to change the receptor in such a way that it's it does the work it's supposed to do effectively. Okay, and then potency affects drug dosage because if you have two drugs, let's say the same paracetamol, but then one you take it once, and then there's another you have to take it three times. Though you take one tablet just once, and then with the other one you take one tablet three times. You see, you'd realize that the first one has a higher potency. You get it? Because you need a small amount of the drug to do that same amount of work. Okay. And is potency really important in pharmacology? Okay, it has its own use, but then it's not an important pharmacological feature that we look at. So, are more potent drugs superior therapeutic agents? No, no, not at all. I guess as we continue, you get to know why they are not really superior. They are not termed as superior therapeutic agents. So, with potency, we usually express it as EC50 or ED50. EC50 that stands for effective concentration, okay, or effective dose that is for ED50. And if it's EC50, effective concentration, you can see this is micromolar, okay, that's the unit for concentration, okay, and then effective dose is in milligram per kilogram. Okay, you take note of that. We will move on and you get it better. Okay, so measures of potency. So when we are measuring potency in EC50, what is EC50 in the first place? EC50 simply refers to the concentration of an agonist drug that produces a response that is halfway, that's 50% between the baseline and then the maximum. So, good. Let's look at this diagram. You see, this is the dose effect graph. Okay, so this is the dose, the concentration of the drug or the amount of drug that is able to. So this one we kept the response into percentages. So this is the 100% response. So the dose or the concentration of the drug that can give 50% of the response or the effect is what we term as EC50. Okay, and that EC50 is the potency of that drug. Okay, the concentration or the amount of drug that we need in order to produce half of the full effect is what we call the potency. Okay, which is either in EC50 or ED50. Okay, and then we say that it is a measure of the agonist potency, that's EC50. Okay, but then if you don't want to use EC50, you can use PD2, and the PD2 is actually the negative logarithm of the EC50. Okay, just as we have pH. I don't know if you remember your pH, negative logarithm of hydrogen ion concentration, and that stuff. You see, the reason why we use PD2 is that, let's look at this graph. You see, so we'll just oppose it better. Don't worry. So you see this thing. We say that EC50 is basically the concentration of drug that we need in order to produce half of the effect. You get it? If the EC50 is high, if you need high concentration before you produce just half of the effect, it means your potency is low. It means you're not really potent because you have to take a lot of the drug before you get that middle amount of effect. Okay, but then if the EC50 is low, that is if the concentration is low, okay, then it means that it has a high potency because you need just a small amount of the drug in order to produce that midline effect. I don't know if you are getting it. So we say that the concentration and the potency, they are actually opposite or inversely proportional. So the more concentration or the more amounts you need to produce the effect, the less potent it is. But then if you are using the PD2, they are just proportional. So if the PD2 is high, it means that the drug is more potent. I don't know if you are getting it. But then when we are using the EC50, okay, if the EC50 is high, then it means that the drug is less potent. That's why pharmacists rather choose to adopt the PD2 rather than the EC50. Okay, so I think we've stressed on this, so we can go on. So this is just the response, and then those curve, those response curve. So we can see that I don't know why they kept this here, but then it's supposed to be here, so that we trace this towards this, and then we trace the EC50 here. So the EC50 is here. The concentration at which the organism exhibits 50% of the effect. You get it? That's the EC50. So it's actually either a concentration. If it's concentration, that's when it's EC50. And if it's a dose, that's in milligram per kilogram, then it means that we are rather going in for ED50. Okay, so now let's look at potency. So we are still on potency. So when we have three graphs, okay, on the same sheet. This is let's say a neuromuscular blocking agent. Okay, you see that they all started from almost the same place. Where is my mouse? Okay, they almost started from the same place. And then this one took a 10 here, that one took the 10 here, and this one took the 10 there. You can see that this has the highest potency. Why does it have the highest potency? Because let's look at the EC50, or this is drug dose, so this is ED50. So you see that this is where the 50% of the neuromuscular block is occurring. So, mhm. So from here, if we trace, you'd realize that you need just 0.1 milligram per kilogram of the drug to produce 50% of the effect. That is for the first drug. But then for the second drug, you need almost 1 milligram. I don't know whether you are getting it. That is times 10 of what you need in the first drug. And then this one too, you need about 10 gram before you can produce that same 50% of effect. You get it? So you have to take more of this drug, followed by this, and then you have to take just less of this drug or just a few amounts of this drug in order to produce that same effect. So we realize that the first drug is the most potent, followed by the second, and then followed by the third, because this one you need more amounts. You need almost 10 milligram. This one you need 1, and then this one you need just about 0.1 or even less than 0.1 to produce that effect. So from the graph, so what you can realize is that the more right the curve is shifted, the less its potency. Okay, yes, the more right it is shifted towards, the less its potency. So I guess this is more clear. It's clear, so we can move. And now let's look at efficacy. So when we look at efficacy, efficacy simply refers to the maximum effect that the drug can produce. Okay, so just as the potency is the amount of drug that we need to produce a certain effect, the maximum effect that the drug can produce. Okay, so let's say it's a sleeping tablet. When you give, let's say there are two tablets. When you give the first tablet, the person will sleep for 24 hours. And then the second tablet, the person sleeps for only 12 hours. you realize that the first drug has a higher efficacy than the second. You get it? That's different from potency. Okay, and efficacy is mainly determined by the properties of the drug and its receptor effector system. So, properties of the drug, it depends on the bonds in the drug and then the complex, the receptor effector complex. Okay, and then efficacy is more important in clinical use than potency. Okay, and partial agonists have lower maximum efficacy than full agonists, and that's understandable because partial agonists they will work, but they still cannot reach the maximum amount of effects that they are supposed to produce due to certain pharmacological properties. Okay, so partial agonists they can never reach maximum efficacy. Okay. So let's look at this dose response curve with efficacy. So last semester we looked at these ones, epinephrine, no epinephrine, phenylephrine, and ephedrine. So we can see from here that okay, so these drugs are agonists for the autonomic nervous system. They can increase blood pressure. Okay, so let's say we administered these amounts, these amounts of the drugs, and then this is what they did. So epinephrine did this, and then followed by no epinephrine and that. So from straightforward, we realize that with respect to potency, um, where is 50%? This is 30. So 50 will be here. Okay, it means that epinephrine has the highest potency because the rest are shifted more to the right. Okay, so epinephrine has the highest potency, followed by norepinephrine, followed by phenylephrine, and then ephedrine. You get it? Because looking at this one, this is 20. So the maximum is even 20, and then 10 is here. So you need about 50. Looking at this one, you need about 50 milligram of ephedrine before you can produce half of what epinephrine did. Okay, so you need more of the drug before you can produce that same effect. That is about the potency. So, with regards to potency, epinephrine has the highest, followed by no epinephrine, followed by phenylephrine, and then ephedrine, according to the graph. And then with respect to efficacy, we know that efficacy is the maximum effect that the drug can produce. Okay, if that is so, let's look at the maximum effect. We can realize they are about 30. So if the blood pressure is able to increase about 30%, then it means it's that's the maximum. Okay, so we can realize that the maximum, looking at the maximum, all these drugs, epinephrine, no epinephrine, phenylephrine, if they are all given in higher doses, you can increase your blood pressure by 30%. Okay, so these ones have almost the same efficacy. Okay, but then looking at ephedrine, you see that as the graph increases, it begins to flatten here. Then it means that no matter how much of ephedrine you give, the blood pressure cannot increase by 30%. It means that it has the lowest efficacy. So somebody who has a very low blood pressure, we don't require, or we don't have to give the person any drug like ephedrine because it wouldn't be able to increase the blood pressure much. So when somebody is suffering from cardiac arrest and you want to give that person some adrenaline in order to trigger the heart, you don't go in for ephedrine because it has a low efficacy. You get it? But then these ones, they can do the work so well for you. You get it? So this one has the lowest efficacy. And then these ones have almost the same efficacy because they produce almost the same amount of um, increase in blood pressure. Or better still, we can say that I think the blue one is very high. So if there's a question that wants a particular answer, then we may take the blue one, which is phenylephrine. Okay, yeah, but I actually doubt. So we move. So that is the dose response curves. So let's consider these two graphs talking about efficacy and then the dose. So we can realize that um, meperidine, okay, or which has the name Demerol, it has the highest efficacy, followed by this one pentazocine. You get it? Because this one has a higher efficacy. It has the highest, followed by this one. But let's look at potency and see something. Potency 2, yes, potency 2 is the same. This drug has a higher potency than that because you need a very small amount of that drug to achieve this half, and then you need more of that drug to achieve the same this one pharmacological effect. And then let's look at the potency. Potency. So if we are just opposing morphine and meperidine based on potency, then you realize that morphine has more potency. Morphine is more potent because though they have the same efficacy, they can perform the same amount of work. You need small amounts of morphine. If you look at the dose, this dose may be, let's say, 2 grams, and this dose from here to here, it may be about 5 grams. You get it? So you need about 5 grams of this drug to produce the same effect that 2 grams of morphine will produce, which means that morphine is more potent than the other. Now, log concentration response curve. So with this one, it's the same thing. So we have drag L, M, and N. And then when we look at it critically, we realize that let's say this is the highest effect that can be produced. Let's look at half of it. We can see that L and N has almost the same potency. Okay, has almost the same amount of potency. Did I say potency? I'm sorry. Has the same amount of efficacy. Okay, has the same amount of efficacy because they can produce almost the same amount of maximum effects. Okay, but then M's maximum effect is lower than both of them. So M has the lowest efficacy, followed by, let's say, L, and then followed by N. Okay, and then when we look at potency, we know that half of it, so L has the highest potency, followed by M, and then followed by N. You get it? Because the more rightwards it is shifted, the more or the less its potency. That's the more amount of drug you need to produce that same amount of pharmacological effect. Okay. So let's look at the slope too. So when we have a dose response curve, the slope of that curve also speaks volumes about the drug. Okay, we have a steep slope and a gentle slope. So looking at these two, mm, look at the gradient. This one is very steep. That is also steep. But then this one with a slope 0.5 is quite gentle. Okay, so the shape of the curve describes drug binding to receptors. Indicator of useful dosage range. That's the steepness of the curve. So the steepness of the curve indicates the useful range of the dosage. Okay, the slope have more theoretical meaning than its practical meaning. So we will get to understand. So um, let's look at this one. You see that slope? This is a gentle slope. That is a steep slope. You get it? So the gentle slope drugs are very safe. So the slope also determines the safety of the drug. Why? Because you can see that from here to here would be, let's say, just one. From this side, let's say from -8 to -6 is just about 2. And looking at just about 2 moles change in the concentration, look at how steepy or how radically the drug was able to rise. So just a small change in the concentration rose the effect very, very much. Okay, but then this one, looking at this one from -9 to -4, the change is not so much. The change in the effect isn't so much as compared to these ones. This means that when this drug is given to you by the doctor, and the doctor says, let's say, take one, and you even make a mistake and take one and a half, the amount of effect that will be on you or the amount of suffering you may suffer will be very high and may even result in death. So if the drug it has a very steep slope, it means that very much care should be taken, okay, when administering the drug, because a very little mistake that anybody makes may result in a toxic effect on the patient. But then if the drug has a gentle slope, even if you increase the dose, the change wouldn't be so much. Okay, so you don't really need to take that amount of um, caution, you get it? So the slope of the dose effect curve can also determine the safety of the drug. If the slope is more gentle, it means the drug is safer as compared to the very steep one. Okay, yes, because a little change in the concentration would result in an abrupt increase in the pharmacological effect. Okay, so let's look at these ones. We can see that this slope is quite gentle before it rose. It was quite gentle before it rose, but then this one rose quite suddenly. Okay, so let's look at the distance from here. They were all on the ground, but then this one took more distance before it rose than this one. This one didn't take much distance. Okay, or rising. You get it. So, what this drug is trying to tell us, it's trying to tell us two things. That though this drug, you take a very small amount and then you start feeling the effect, okay? But when you start feeling the effect, even a change in the concentration of the drug, even if you increase the concentration, you wouldn't feel much change in the effect because it has a gentle slope. But this drug, when you started taking it, you were not feeling anything. Oh, you take more, you were not feeling anything. But as soon as the effect started coming, a small change in the concentration brought more effects that were disastrous. You get it? So this one you started feeling the effects, but when you increase the drug, you didn't see much more of the effects. But this one you were not seeing any effects. So you got to a certain concentration and then you started seeing the effects. You changed the concentration a little and then you are even dying. The effect is becoming so toxic because the slope is very, very steep. Okay. Okay, so these are the importance of the dose response curve. It's used to determine if a drug um, would produce a certain desirable effect. It determines the potency or dose required in producing effects. And we can use that to compare one drug to the other, just as we can compare this drug to the other, based on their efficacy, potency, and safety. Okay, we said that the slope of the curve gives an idea of the safety, how safe the drug is. So let's look at this one too. So looking at drug A and drug B, they have the same words efficacy, but then drug A is more potent than drug B, and then drug C has the lowest efficacy, and then its potency, we can say that its potency is between the two. Okay, yes, though the effect is low, but looking at the graph, its potency would be between the two. Okay, so we'd move on to antagonist maybe in the next video. So we know that an antagonist attaches to the receptor but does not really produce any effect. Okay, so we say that since they're able to bind to the receptor, they have affinity, but they don't have any efficacy. The ability of the drug that has bound to the receptor to change the receptor in a way so that we experience some pharmacological effects. Antagonists are not able to do that. Okay, and these are the types of antagonists. So we'll look at them in the next video.